However, infrequently are children are infrequently consulted with regards to technology. And I think it's very critical at the beginning of a program to really do some informal discussions with children and understand what their interests are when it comes to facilities, what types of facilities they want to use, what types of facilities they like to use. And there's a very interesting article by Miriam Sidibe that I will post on the course website after this, entitled "Can Hygiene Facilities Be Fun and Cool?" And it talks about how to engage children in a way that they will think of the facilities as their own and really take ownership. So the second set of stakeholders, the families of the children, and those family members, their roles include encourage children to comply with procedures for use and care of wash facilities, enable facilities at school and develop positive hygiene behaviors, and support or participate in parent-teacher associations or similar bodies. We also know, and I think that it was pointed out, that parents can also be the beneficiaries in terms of the diffusion of practice to the home, and they can really encourage their students to educate their siblings. Teachers are a key stakeholder, obviously, and their roles include monitor the state and use of school wash facilities, organize the care and maintenance of the facilities, and encourage school children to adopt appropriate behaviors at school and home through hygiene education. I don't know about you, but I've been to many schools where teachers have never visited the latrine, or when I went to the latrine with them, they were embarrassed because they just didn't realize how poor the conditions are. And we found that just simple checklists can help engage teachers in the process of understanding the conditions at the latrines. So school directors and head teachers are responsible to organize the setting of targets for water, sanitation, hygiene at the school level. So understanding what they want at their school and how to go about achieving those standards. What are the critical components of wash in schools that they feel their school needs to achieve? Second, to be the liaison with education authorities. And again, that speaks to the idea of accountability. Create conditions in which staff are motivated to achieve and maintain targets. Develop and enforce rules where required, and encourage parent-teacher liaison. And I don't know if you remember, in the last module, I discussed a number of studies around diffusion of practice from school to home. And I don't know if I covered this or I talked about this, but one of the key components that really improve school to home transfer of knowledge and practice is bringing, not just having the parents hear about the wash behaviors from children or see the children do those behaviors at home, but it's about bringing parents to the school. And parents that see the technologies or the behaviors in action at school are more likely to bring those behaviors and technologies to their home. So it's not just about the children bringing the behaviors home, but it's about the parents coming to school and seeing the conditions at the school. And head teachers and school directors play a critical role in facilitating that sharing. So parent-teacher associations or school management committees, school governors, school committees need to advocate for locally for improvements in school wash, raise funds and help plan improvements within the school, support maintenance of the school facilities, and support provision of consumables. And again, I want to point out the fourth one. The recurrent costs, such as soap and broken taps and all of these things. Oftentimes there is no accountability or there's no clear responsibility for who will take charge of replacing the taps and buying soap and buying water treatment products after the initial program has given their supply. And that's a critical component of planning the program. And the programs cannot succeed unless there's a real plan in place. And not just a promise, but an actual plan in place where someone, and probably it is the PTA or the school management committee, is responsible for raising the funds and purchasing the products to keep the hardware and the software components going. Next stakeholder is the health sector, and this is at a district or national level. They're responsible to provide guidance on the environmental health aspects of school design, construction, and maintenance, monitor environmental health conditions, and monitor child health, provide selected health services, for example, micronutrient supplements, treatment for helminth infection, hygiene promotion, vaccine campaign, maybe iron supplementation, and provide training and advice for teachers, school children, and parents on WASH. So this is really the health sector is the governance framework that we operate under. And it's important while you're doing your local level or district level campaigns, to ensure that at the national level, and I know that UNICEF is particularly good at this, ensuring that the national level, there's advocacy going on. And in the next session, session 3 in January, we'll talk more about advocacy and how to really build an advocacy campaign with government stakeholders. And the health sector is obviously a key one. The educational authorities, so similar to the health sector, the education authority has a role to play, obviously, in school WASH. And they're the ones often that provide resources and direction for achieving and maintaining targets. They advocate at the district or national level for adequate resources, ensure that sufficient technical support is provided, so they're often the ones that know the local technicians, the local companies that can come in and construct facilities that meet the government standards. They often monitor implementation of WASH guidelines, or they need to. Oftentimes they don't monitor implementation of WASH guidelines. They often monitor other school indicators, but not necessarily WASH. And they provide training for teachers and other school staff. And so these are the people that need to be targeted for changing the curriculum in schools so that more health education can be taught if there is no WASH education at the school level. And finally, this is the last slide on stakeholders. The public works and water and sanitation sector, their role is to ensure correct design and construction of school buildings, ensure correct maintenance and training of local school caretakers and maintenance staff. And then, of course, the construction maintenance industry, including the local contractors, provide skilled services for construction, maintenance, and repair of school buildings. So again, it's a long list of stakeholders, and there are a lot of roles that these stakeholders can take. And there's a need when you're starting out your program to make your own list of the stakeholders, what you expect, what their current role is, what their current role is, and what you expect their role to be during the program. There are other stakeholders as well, such as the private sector, that can play a role, specifically maybe local shops, or even CBOs, women's groups, or larger private companies such as Unilever or other soap providers that can play a role. So again, this isn't there are many more stakeholders you may want to consider when you're thinking about your program. So targeting. Again, I want to point out that it needs to be a transparent process. And the key aspects of targeting are how will you choose the selected districts, and how will you choose the schools? What schools are you going to choose the most marginalized schools? Are you going to choose the ones that are marginalized but also have a chance of success? How are you going to spread around the money? Are you going to give a lot of money to a few schools, or are you going to give a smaller amount of money to many schools? I think it's important to think about really what your main objectives are and what your greatest chances of success are. And there's always a balance around equity of whether you should try and reach those schools that have nothing but may need a huge amount of money in order to achieve some kind of sustainable provision, or do you reach a broader number of schools that have that are a little less marginalized but that also need a lower level of support? I think these are questions that need to be asked when you're starting your program. Will the targeting be data-driven, or will you get recommendations from district stakeholders? Will you do district-level coverage, or will you scatter it across different districts? It's important to think about these things. As part of a program that I discussed last time called SWASH Plus, this is our list of targeting. This is the list of the things that we targeted or looked at in order to target schools. So there's poverty level and poverty index from government data sources, disease outbreak statistics, mainly cholera is what we were concerned with, disease burden, presence of other NGOs conducting WASH interventions. That was important. We wanted to try and stay away from places where other NGOs were operating in order to minimize duplication. And school and community sanitation coverage, pupil population, we wanted to reach the largest number of pupils possible. Logistics and accessibility of schools, demand for interventions, and applicability of interventions, including access to water, rainfall patterns, and geology soil formations. I want to take an aside and say I see there's a lot of comments on the discussion board. I think that's great. It's nice that there's parallel discussion going on about some of the things that are being said. So I really encourage that. I think the budget component is one of the hardest for me to really go into in detail because it's going to be so context specific. I just want to throw out a few areas to pay attention to, but I think that, again, this is going to be very context specific. For hardware, there's a need to consult government standards and local contractors to ensure that the budgets are appropriate. I've done a recent study on urinals in school in Kenya, or I've looked at a recent report that actually is going to UNICEF, and looking at how the urinal ratios can really reduce the costs of adding urinals can really reduce the cost of latrine construction and reaching the desired pupil to latrine ratio. In terms of software, I think we all know that this is often ignored and one of the first areas to be cut when it comes to the budget. So it's important to keep in mind the expense of training teachers, mass media campaigns, school posters, or paint for promotional materials. Curriculum development is a long and difficult process and requires a lot of staff time. There's a need for specific child-to-child and parent-to-child education components and money for school competitions. So all these things require money, and it's important to ensure that there's budget allocation. And then, of course, recurrent costs is something I've talked about a number of times. It's important, I think, to visit local shops and make sure there's a supply chain for some of the components in your school WASH program. Make sure that shops have it. Maybe arrange for special prices for the schools. Maybe there's community-based organizations that promote health products, and you can work with them to make sure that they do visits and that there is a budget to engage those folks if necessary. And then, of course, monitoring. So monitoring is the last component of a plan of action, and I want to just point out that we'll be discussing that more in depth at a later date. So number 2, the key steps. The key steps for a WASH program, you need to raise awareness, establish or engage stakeholder groups, review standards and frameworks, assess and provide technical expertise, develop funding mechanisms, monitor programs, and establish ongoing training. And so I want to talk about how those manifest at the national, district, and local level. At the national level, you need to review existing policies, explore and potentially establish coordinating bodies. So make sure, there's oftentimes may not be a clear lead agency in Washington schools. Perhaps the education sector thinks it's the health sector's role, and the health sector thinks it's the water and public works role. So make sure that there is a coordinating body and really engage that coordinating body.